Good afternoon, everybody. I believe I am the last thing between you and lunch, so I will aim to make this worth the wait. Just a few words before diving in today. I'd like to kind of walk you through the journey that Blue Shield as a company has been on. I'll share a few more words about Blue Shield, and actually our agency partner in this work, Butler Shine, has been instrumental. Blue Shield is California headquartered. We are a not-for-profit Blue. California is one of the few states where you actually have competing Blue systems. So you've got Anthem Blue Cross and Blue Shield of California. It's also a market that is far more HMO than you see on the East Coast. Kaiser is the largest player in the market. They are an integrated vertical system and a formidable competitor. So in that environment, I'm going to go a little deeper for a moment here and just beyond the California market, talk about some of the themes that have been emerging throughout the morning. And I forgot to say how much I've enjoyed just sitting here, participating, listening in all of the discussions. There's lots of great, rich material. In this characterization, and I think the conversation today kind of mirrors that, it's just such a, healthcare as a sector is so rapidly evolving. It's a $1 trillion industry, multiple players. You've got the incumbents, the payers, and the providers. We're definitely in that incumbent category. You've also got upstarts trying to kind of fit into that payer-provider space, but do it differently. I would describe Oscar that way. You've got the Amazons of healthcare coming in, other outside sector players that have capabilities that could be transformative. And you've got huge mergers like the CVS-Aetna merger. So it's a very dynamic environment in which to try to compete, grow, survive are central questions. There's also, as I think Cindy's talk earlier today with the At Living Proof campaign, I loved hearing about that. There's such a powerful human element that runs through all of this. And when you really start there, as our company is aiming to do, that has a different type of transformative power. I won't go into all of these articles, they're just here to sketch. But the Huffington Post, I think, is very illustrative. It talks about one family that clearly benefited from the ACA and had access to care that they would not have had that not gone through. And another family that felt that economically they'd been hurt by it, and in many ways they had. When you go even deeper, and I loved hearing the D2C conversation around what it means to go direct and ways that really just flip the model on its head. But not only are there the stories of the uninsured, but consumers that are struggling and buying in, get that coverage, but then still struggle to actually use it. And as a company, we wrestle with all of that. We knew that in this environment, we had to fundamentally change some of the ways that we do business. We also knew that we would have to go deeper with consumers, really understand them. But the business journey, this is sort of easy to say in hindsight. The business journey itself at times was wrenching and very complex. When reform went through, we were very excited about expanding our individual market, going on the public exchanges and covered California. We are currently a leading player on public exchanges in terms of the membership volume. However, we weren't fully equipped to manage that population, and by that I don't just mean the risk in understanding the new types of members we had on our books to price accurately or develop the right kinds of utilization models. It was also just the sheer volume. So we were in the midst of a fairly massive technology upgrade, and we had real systems issues when this influx of membership through the exchange came on board. In some ways, some of our operations ground to a halt. It's very difficult internally in terms of morale, and far more importantly, we weren't serving members in the way that we wanted to. So we were going through all of those growing pains, but we remained fundamentally committed to our growth agenda. The mission of the company is very much around achieving tighter partnerships with providers. A lot of our strategic portion of our product offering is through accountable care organizations and sharing risk with the provider partners that we have in those. And we decided, coming out on the other side around 2016, we'd been silent in the market during the period I was describing. We really felt that we had to focus internally, stabilize, meet commitments, serve the new members on our books. But we felt by 2016 that we were starting to come out of that and that we needed to be out and communicating back in the market, and that we needed to understand how, in terms of perception and where we were as a brand, things had evolved. And we learned a tremendous amount as we started to go through that. Oops, I was a little premature there. We did a mix of quantitative, qualitative. We ended up doing work that we described as co-creation labs with consumers and employees. But the kinds of things that we found during this period, not surprisingly, we did have some customer abrasion. There were segments of the market where our favorability had declined, but there were also really promising other spots, new members that were excited to have coverage and were having a good experience, prospects who remained interested. Cindy mentioned earlier Blue Equity, and Blue Equity is very strong even in a market where the Blues aren't in the top leadership position. So we took that, and then we started to go deeper in terms of what consumers were really telling us about how they felt around healthcare, not just around providers, but payers. And it was very striking during this time to compare the kinds of things I would say we heard consumers describing in focus groups, even just 5 years earlier. There had been a shift, and there was, I would say, greater sophistication across the board. Consumers have been learning about healthcare through all of this because they've really had to. There was more gray and less black and white. One of the things I mean by that is, I would say historically, in a focus group, it would be very plain to see that the relationship with a provider is the most trusted, and sort of providers, white hats, payers, black hats. It had gone a lot more gray. There was a lot more kind of questioning about the roles these different constituents played in their health care. And there was also a very sophisticated take on what health meant to them, and very personal stories around that. Sometimes we would ask people to bring in, say, an object into a qualitative session that for them symbolized either their health or healthcare, and get them to talk about it. We had everything from, one woman brought in a sponge because she felt that her healthcare was just soaking up everything. It was powerful and quite negative. There is another consumer who brought in a beautiful but small piece of art that a friend had made for her that captured her personal journey around healthcare. And when we pulled back from all of that and kind of summed it up, some of the things we were hearing were not just these. By the way, a couple of these stats I will just call out. Not all of them from primary research. Some of this was just pulling from studies, Pew, Kaiser Family Foundation, et cetera. But half of consumers are saying that medical treatments are creating as many problems as they solve. Over 80% still saying that affordability is getting in the way of quality care. I think that really speaks to the D2C conversation that we just had. And increasingly higher willingness to switch doctors in order to either save money or have different types of benefits. On top of that, consumers told us that for them, health is mind, body, spirit. It is not all about medical benefits. It is not all about drugs. It is about their mental well-being. It's about stress. It's about their relationships, community, family, in terms of their own kind of overall well-being. It's also, I guess I didn't capture it quite there, but the stigmatism around mental health is something that consumers feel acutely, and yet the vast majority of them will say that either they or others in their family have mental health needs that they struggle to meet in one form or another. So there's an appetite for a much more integrated view from providers and from payers of their health and their health care, and a willingness to engage at that level, which is also, I think, tremendous opportunity in general for marketing. Healthcare is all about communication. Marketing is all about communication. And the upper to mid-funnel piece of it is just scratching the surface. It's tremendously important, but there are opportunities to go much deeper in the role that marketing and marketers play in healthcare. With those insights, we did realize that to do this as a company, we really needed a strong foundation and that we needed to get very fundamental about it. So we made a decision. We could have started in a lot of places in terms of investing in marketing. Blue equity in general is strong. Despite the ups and downs I described, ours was still fairly strong. But nevertheless, we felt that the reason to start with brand was that we had to consider employees and executives at every level as very key to what we were trying to do, as well as reintroduce ourselves in the market and establish some kind of emotional connection with consumers, all the more so from having been dark for several years. I think people here know this. I'm not going to pause. The brand positioning that we went with, it's not really about the words on the page, but we did just start with that basic piece. What we were hearing in the focus groups as an opportunity, we tried to translate in our positioning as an emotional benefit of healthcare. In other words, that feeling that whenever you are feeling at your best, you feel more potential in your life. When you feel your best, you feel unstoppable. And there's so much uncertainty and complexity around healthcare that building that confidence and playing that role in terms of our offering was going to be important. We also created a brand line, Never Stop, that appears in a lot of our upper and mid-funnel efforts. More than the positioning itself, where we focused in the initial expression of the brand, and again, thinking internally and externally, was we really wanted an inclusive vision that would mirror the California market. And the California market is changing about as rapidly as healthcare. The Hispanic segment in California just became the dominant segment in California as of this year. It continues to be one of the fastest growing. Like the rest of the country, we have our share of seniors aging in. The pre-SPRY crowd in their 50s and 60s that I heard somebody reference earlier today. And, cultural competency in our market, and I know it's true in some East Coast markets as well, there's a multitude of not just languages, but additional cultural considerations that come into play if you're really trying to deliver care differently. We wanted to capture some of that in our imagery, but we also had a concern. If you think about that low bar that Steve set for creative in healthcare, there is this kind of sea of sameness, either in terms of stock photography or lifestyle, health and wellness types of imagery that we wanted to be able to break through. As significant as our marketing investment has been for us as a company, it is still a drop in the bucket in terms of what the top spenders in California are spending. United actually leads the market in terms of media spend in California. Humana is close behind. So we focused a lot on photography, portraiture, really trying to capture people as people in that proprietary imagery. We paid attention. We heard in consumer research that sometimes our advertising felt a little lonely, was one of the words consumers used, and we realized that the shots where people had a more sort of heroic type of stance, I would describe the woman on her right as where there's this, like, a little bit of heroizing in the photographic approach, with talent that was photographed individually. We needed to bring in more family, more couples. We started doing that as we evolved our portfolio. And I am going to just play, I will get to a kind of 2-minute or so reel in just a moment, but I wanted to share as well, in the market for 2 years, really 18 months, this time frame that I'm sharing with you, we kept that look and feel very constant, and we expect to do that for a long time. What we have evolved is our messaging and positioning around some of that. So for example, in 2017, a number of national players exited the public exchange. There's a lot of consumer fear and uncertainty around that, and we launched an evolution of our campaign called We Care About Here. You'll see some of that in the reel. And building on that going into this year, we went back to, in some ways, what is a classic component of Blue Equity. Big open access type of system offers a lot of choice, but we also tied that into more of the emotional benefits around choice. So some of that will come through in this reel. Let's go ahead.
Having your face tattooed, a lot of people just judge you straight off the bat. It's always funny when I take Issa to school, all the other parents and teachers see me and they're just tripping out. In a tattoo shop, everyone's welcome. Bringing Issa into this world, she got to see all kinds of characters coming in and out. I think it's good to have her exposed to all that, being able to see everyone getting along and treating everyone like family. It's cool to just kind of experience those things together.
We're surrounded by infinite possibilities. It's up to us to see the choices we have and summon the courage to make them. For when it comes to our life, our health, every choice we make matters.
So one thing I forgot to describe going into that, for each of the individuals that you saw, like LaToya is here, Adir is here, we ran these spots, storytelling, but talking about their experience. LaToya was a professional dancer during the day, security guard at night. Adir talked about his struggle with addiction. There was just a kind of series of stories that went along with the clips that you saw here. We also talked with small business owners. The boxing gym was a story about a guy that was trying to keep his business afloat. Through all of that, we made an extra effort in thinking about media placements and how we engaged employees. So part of it is just pure internal environmental branding, bringing the brand into all of our office locations. We're statewide. Some of it is much more around how we're engaging with employees. We have a lot of, as many companies do, resource groups. We've got, for the entire population, we're 6,500 employees. We're launching basically one new resource group a year over the last several years and working with them to participate in community events, help bring the brand to life. Some of our sponsorship activities has also played a key role. The initial results from this should go, here we go. In the 18 months that we've been really out in the market with our media, we've generated 3 billion impressions. We have increased ad awareness significantly, much harder lift to get unaided awareness up. And again, we had been dark in the market, but we are seeing those percentage points tick up as well. The overall approach, and here you're seeing sort of like the glossy advertising, but we're carrying it through all of our marketing and touch points, has had very positive impact on likelihood to consider and recommend, as well as the perceived value of the brand. The last statistic here is, the wording is actually a company I'd be proud to work for. And it has been playing a role in our recruitment efforts. We've seen a significant lift there, as well as in our internal Great Place to Work scores, a 10 percentage point increase, because we really worked the brand together with investments in employees and the role that they had played in helping to turn the company around. So those things were working together to achieve that. But I mentioned earlier that the kind of upper mid-funnel piece of all this is really just scratching the surface, and I really meant that. So while a lot of this has been kind of bringing you along with what we were going through as a company and how we expressed it, by far the most impactful but important work is in front of us. And the way that we're tackling that is through the brand work. We've really gone through a lot of internal dialogue. We've taken the core values of the brand expression you saw here. We're actually midstream with talking to employees about simplifying a set of 7 very corporate sounding company values, customer-centric, those kinds of words, into 3 that will be more motivating, hopefully prompt people to take risks, keep people grounded in the mission. There's basically 3 values that we will roll out. Much more importantly, they become a springboard for conversations about where do we go in terms of product design? How can we use the brand as part of the investments we're making in innovation? We recently hired a chief innovation officer. For those of you familiar in classic innovation process and human-centered design, there are these upfront phases that are all around empathy and defining the problem that you're trying to solve and the end user experience. Huge opportunity for brand to play a role in that part of the process. We continue to redesign our end-to-end processes, everything from claims to enrollment to, from a marketing standpoint, the one we're truly accountable for is communication. like many incumbents in this space, if you try to get your arms around all of the internal departments that may communicate directly with members, system-generated communications, vendors that play a role in communicating, it's a beast. And we're recognizing that marketing as a discipline has so much work that it can do to improve the experience our members are having just through how we're communicating, that we're investing heavily there as well. And then content. There's been some talk today about investment in content and content marketing. That's huge for us. We've launched a content hub just in the last 3 months with the intent to continue to build it out over time. So I think this part will be ultimately more important for the company than a brand advertising campaign can be. But in many ways, that external focus on who we are as a company and how we were showing up is how we're getting here. And it's garnered a lot of momentum internally, which was kind of the point. With that, this is it for presentation, but I would love to talk with any of you on questions that you have.
We have time for some questions.
I don't need that. Yeah, you do. Yeah, I do.
I want to get you on tape.
Okay. It's
I want to get you on tape. Everybody's on the record.
all right. It's not really a question. Just a comment on the creative and the imaging. It's fabulous. Black and white, fabulous. The people, fabulous. The imagery. So congratulations to you and your team. Did a
Thank
great
you.
job.
Thank you. Appreciate that.
I'm really curious about the. I'm curious, since you have such stark new branding, and I know in talking to you, you put such an emphasis on the coherence of that branding across all of your properties, and now as you're starting to move to the product piece, customer service and things like that, how are you, and I know that's a work in progress,
Yes,
but
right.
I think one of the things that we learned from the D2Cs is that customer service is branding. It's
It
one,
is.
like one of the strongest forces of branding in the whole D2C phenomenon. We started learning this years ago with Zappos, because they famously used to say, we've spent 12 hours on the phone with a single customer.
Yeah.
So that kind of learning and understanding that, I'm curious, as you're going into that piece, how are you communicating with your own employees about how this translates into everyday conversations with patients and customers?
Great question. In multiple ways. So, you know, it's more than, to your point, rewriting a script or redesigning an IVR. And not that those things don't require investment and focus, they always do. But it's really in shifting mindset, very much a work in progress in terms of getting to the front line. I think we're at that stage where we have the buy-in across leadership, and the leverage comes from frontline employees taking more pride in the company and living up to the image that we've put out there. I think that, you know, when you get into specific types of capabilities, there needs to be training involved. There needs to be a push on, you know, it's not just about the phone lines. We've got to really rethink the ways in which we use social as a channel. There are other types of investments in terms of just aggregating the data and the systems to empower frontline staff. So it's one of the barriers to a positive customer experience when it is over the phone. Often is just like disparate pieces of information about who you're talking to. And the more that we are able, we're sort of building on the technology upgrade now with data strategy, but the result of that will be very impactful for frontline when they're interacting. They will simply know more about the member they're speaking to than they have in the past.
I have loads of questions myself. You mentioned your content hub. Could you tell us what the strategy is there? What sort of content should you as a brand be publishing? Is it mainly about your product, or do you see yourself having a larger publishing role for this for healthcare content consumers who are voracious?
Yeah, it's an exciting space. So we actually partnered with the New York Times in our first wave of work around the Content Hub and their T-Brand studio, and continue to work with Butler Shine on some of this as well. But the belief is that when you think back to that insight I described in focus groups of consumers really feeling that they are on their own, the system isn't working for them, but yet they are hungry for information. When you're on the payer side, the health plan, insurance company side of things, you are always faced with that reality that it is the way that many consumers experience cost in the industry is through their insurance premiums. And they want more, understandably. So we actually called the hub Get More. We started by centralizing, there are really like vast arrays of relevant content for members. They want information about health conditions. They want information about what to talk to their doctors about, treatments and procedures. Sometimes that's very fragmented between what they get directly from the doctor's office, what they go online and research. And part of our role can be to point them towards resources as well as simplifying the search for that. So it's a content-rich space. The work is really in breaking it down in a way that will be engaging, and organic search over time will have to play a huge role in that as well.
Thank you. My name is Dennis O'Leary with Univision Communications, and enjoyed your presentation, and your creative, really wonderful.
Thank you.
Question, and I'm sorry if I missed it, but for those Medicare Advantage patients that you depend on quality score ratings with CMS, have you been able to have that metric measured and as it relates to the engagement campaign?
We haven't been able to tie, say, like Medicare stars to this in particular. I will say that the work has improved perceptions of us in terms of quality. So what people that see us out there believe that if you're going to engage in that way, that you are going to invest in quality generally. But I can't take any credit for the increase that we are making. We are seeing increases in our quality scorings, but that is very hard hands-on work with providers, and much of it is around charting and filling care gaps. The role that marketing can play isn't this so much as how do you communicate much more effectively around care gaps? Often consumers just get a letter from a doctor or an insurance company saying, you really should go take this test, or trying to close gaps in that way. It's not meaningful for the patient, the member, the consumer.
Kimball, thank you so much.
Thank you.
We're going to break for lunch now.